Welcome back to Good Morning Mississippi. I'm Frank Howell of Delta Council, and our special guest this morning is Josh Davis, Director of Institutional Advancement for Delta Health Alliance. Good morning, Josh.
Morning, Frank.
Josh, we recently, Delta Health Alliance, received a visit from Project Hope. Tell our viewers a little background on Project Hope.
Sure. Project Hope is a global health foundation that's been around for over 50 years. They have operations in over 35 countries, and that spans 5 different continents. And what they have been able to do is to figure out how to implement sustainable, long-term solutions to pressing health issues and health matters. They do this by implementing health education programs and also by providing humanitarian assistance in areas of need. So very proficient at going into areas that have been decimated in terms of what their health care facilities were, and filling the short-term and the long-term gap.
What was Delta Health Alliance, why were y'all so interested to receive this prestigious visit?
Well, people in the global community recognize the legitimacy and the professionalism and what Project Hope brings to the table in terms of resources, volunteers, experts in their field, and by and far, a majority of their work is done abroad. They have just a handful of domestic ventures that they have just recently begun getting involved with, and the Delta Health Alliance being one of the 3 that they were involved in. So we were very interested to learn that they were pursuing some domestic partners, and we knew that we offered the resources of networks that would be able to give them a foundation to begin exploring some intersecting points of interest between their mission and the mission that we serve.
The visit seemed very successful, and I guess you've got a lot of follow-up and work to do.
It was extremely successful. With Project Hope, their CEO, their Vice President of Development, their Director of In-Kind Giving, and their Communications Specialists all came down to do the tour of DHA's programs. And we left after this weekend, both sides feeling very confident that we had determined multiple points of intersecting interest, and hopefully there will be some short-term assistance that they will be able to provide for us through their in-kind capabilities, and long-term we're hoping to put together a plan that moving forward both of us can work together to really put in place some long-term solutions to some of the chronic diseases and some of the other issues that plague the Delta.
That's great. Well, I guess we'll stay tuned and to see what develops, but Delta Health Alliance is really charting a creative course to address some of these needs in the Delta, and the Project Hope visit was a great example of that.
Thank you, Frank. Looking forward to giving you an update.
Appreciate you joining us.
Thank you.
We'll be back in a moment with more Good Morning Mississippi.